Hello and welcome back to Mental Health with Bay. I am Bay. This is our third video in our DBT series, why we use DBT skills. This video is going to be super helpful for if any of y'all are like me and really need to know why I'm doing something before I start doing it. As a kid, or even now, if someone tells me to do something and I don't know why, I'm very reluctant, I'm very hesitant, I do not want to do it. But if someone tells me to do something and then explains exactly why I need to do it and I agree with those reasons, I'm gonna do it. I'm gonna do that thing. The purpose behind using DBT skills is A, they're effective, see part 2 in this series to learn about its effectiveness. B, because it helps us get closer to our goals. The main goals behind using DBT skills are to decrease problem behaviors and to increase skillful behavior. In part 2 of this series, we talked about effectiveness and how that word is used in DBT. A recap of that is if something is going to get you toward your goals, it is effective. And if it is going to take you away from your goals or prevent you from getting toward your goals, it is not effective. I have paint on my hands from rec therapy earlier, so my hands are a little silly. In this book, the DBT Skills Training Handouts and Worksheets by Linehan, 2nd edition. It's lovely. Get it if you're trying to really get into DBT. She, and by she I mean Marsha, I'm going to be talking about Marsha kind of a lot. Marsha gives 4 options for what to do when a problem arises. There is solve the problem, feel better about the problem, tolerate the problem, stay miserable / make it worse. I'm going to use the example of a bouldering problem because I am a rock climber. I enjoy that. For those who don't know, bouldering is just free climbing. You're not attached to ropes. You don't go very high. Route setters can make bouldering problems especially difficult because it's expected that you're going to fall onto the mat a lot of the time. So obviously the ideal here is to solve the problem. Figure out a different way of doing it. If you have a problem you haven't been able to figure out how to get to the top, ask somebody for more strategy. Maybe work out your muscles a little better so you have the strength to get to the top. Ask a staff member, how would you complete this route? Stuff like that. Ways to solve it where you can actually get to the top. Second option is to feel better about it, change your emotional response to it. So say you just cannot get it, you're not strong enough, you're not flexible enough, you don't have the strategy, it's just out of your skill level. To feel better about it, you're going to change your response to it. So instead of getting really frustrated and bitter and just calm it down. Use emotional regulation skills are going to be really good here, and those will be covered later in the series. It's essentially changing your emotional response to the problem. The third option is you tolerate it. So say you can't solve it and the emotional response just isn't changing. You're just so frustrated that you cannot get to the top of this climbing route. Tolerate it. You're going to accept the fact that you are not going to be able to do it, and you're going to allow the frustration to be there. You're going to sit with it, and you're going to use distress tolerance skills, which again will be covered more later, to keep your distress low enough that you can still function while also having that frustration and that anger and that just about that particular route. Mindfulness is also going to be key while tolerating it, letting your emotions come and go as they go. Notice them, don't judge them, don't get all worked up, don't grab onto them. We're going to talk about mindfulness later. And then the fourth option is to just stay miserable. You can't solve the problem, you can't change your emotional reaction to it, and you refuse to use mindfulness or accept the problem. You're going to be down here. You're going to curse and moan. You're going to kick the wall. You're going to be so frustrated. You're going to complain to the manager that the route's too hard. And it's not going to make anything better. It might actually make it worse. You might be embarrassed by your behavior later, that you acted impulsively. You won't get to the top of the route that way. This is a valid option. This option is typically taken when people are at a skills breakdown point, which is a point where they lose all willingness to use their skills. Not a great place to be. One of the goals of DBT is trying to stay in your window of tolerance to be able to use skills. So those are the 4 options for when you have a problem. Now we're going to shift a little bit, a bit of an aside that Marcia Linehan puts in the book for when you are in a DBT group. So whether you are in like a therapy setting or you're doing DBT skills with your family, you're teaching them to your partner or whatever, there are a few things to keep in mind when working on DBT skills with other people. Assume best intentions, that people are doing the best that they can. You are a support to this person. Assume that they're doing the best they can. Another thing that Marcia Linehan wants us to do, essentially be patient with other people, because some people biologically are naturally more impulsive or have just bigger emotions, and that needs to be taken into account. Life is potentially more difficult, or at least skillfulness is more difficult for these people to achieve than for people who are wired differently. Another factor that can make DBT skills especially challenging to use and to get willing to do is invalidating social environments. So if someone is living in a setting where people are not being kind, are not allowing this person to feel, allowing space or safety emotionally, that can be a very difficult place to start DBT skills. And I'm not saying these people shouldn't start DBT skills. Probably more important for these people to learn these skills, because that will enable them to break the cycle and get out of those invalidating environments and create more validating environments, attract people who are going to be more validating for them. Thank you so much for watching this video about why we use DBT skills and what to keep in mind when we use them with other people. The next video in the series is going to be about analyzing behavior with behavior chain analysis. Make sure to like and subscribe for more free mental health content. Thanks, bye.